Good afternoon, ladies and gentlemen. Thank you very much for coming. And first of all, I should like to greet Professor Werner Hacke, who is third time here in Debrecen. And it's a great honor for us, not only for me, but also for the university, that tomorrow he will get the honorary doctorate from the university, from our university. Although many of you know him, but I should like to shortly summarize his previous activity. Professor Hacke graduated from the university in 1975. He got his PhD in 1983, became the associate professor of neurology in Aachen in 1984, visiting professor between 1986 and 87 in California, Clinical Research and Research Foundation, Loyola. He is the professor and chairman of Department of Neurology, Ruprecht-Karl-Universität Heidelberg, since 1987. He was the dean between 1989 and 1991 of the university, the medical school, and also since 1994 till 1996. He had many memberships and functions. I should like to select only some of them. For example, chair of German Work Group Neurological Intensive Care, member, chairman of Research Group of Neurological Intensive Care of the World Federation of Neurology, president of the German Society of Clinical Neuroscience, honorary member of Austrian Stroke Society, honorary member of French Neurological Society, honorary member of Hungarian Society of Clinical Neurosciences, member of the Heidelberg Academy of Science. He is also the honorary president of American Neurological Association, European Stroke Organization, American Neurological Association, and honorary member of the German Neurological Society and the German Society. He is the editor or member of editorial board of Nerve and Arts, Journal of Neurological Sciences, Cerebrovascular Diseases. Previously, he was very active in neurology, the board of neurology, and he was the European editor of stroke. Acknowledging his activity, he received numerous awards. For example, Excellence in Stroke Education from the Canadian Stroke Association, Karolinska Stroke Award, Stockholm, Sweden, Princess Margaret Memorial Lecture, United Kingdom Stroke Forum, President's Award, World Stroke Organization, Nonne Award of the German Neurological Society, Mihara Award. And he chaired numerous, for us, very important clinical trials, including ECAS 1, ECAS 2, Austin, Space 1 and 2, DIAS 2, ECAS 3, Destiny, Space, and member of the Executive Committee of Rocket. He published more than 350 papers in the field of stroke and stroke research, and the number of his citations is more than 50,000. He published not only books in the special field of stroke research, but he published also books for education. For example, the Neurology enjoys now the 12th edition. First has been edited by Klaus Böck. And the English version of this book just got the 13th edition. So we are really very happy that we can greet you again in Debrecen, and very curious about your lecture, and congratulations again for your honorary doctorship of the Debrecen University. Werner, please.
Dear Professor Chiba, dear Laszlo, ladies and gentlemen, I'm really happy to see so many people here on a Friday afternoon. That is very much appreciated. Thank you for coming. And the lecture that I have prepared is a lecture that can be understood even if you're not a neurologist. It's more thought to give you an overall impression of what has happened in the field of stroke in the past 20 or 30 years. And when we talk about stroke, we talk about a disease that was a disastrous disease, that was formerly untreatable, and a disease that has become treatable over the last decades. So the content that I'm going to talk about is, first, I give you a little bit background information about the worldwide burden of stroke. Talk about the epidemiology, about what will happen over the next years in our countries, but also in other countries of the world. Talk very shortly about risk factors and prevention, but I'm not going to talk about trials in that field. Then I have one slide summarizing treatment of stroke 30 years ago, which was close to nothing. And then in more detail, I will describe the dawn of the new therapies, how that all happened, because Professor Chiba and I, we were eyewitnesses of what happened. Actually, it all started, and I will come back to that in a couple of minutes. It all started when we got the CT scanning. Before that, the world in neurology was completely different. No one in this auditorium here is able to imagine what it meant to do neurology without CT scanning. That was almost impossible. I was a young resident when the first CTs appeared. And so I witnessed what happened ever since. And then we talk about where are we now, what are the evidence-based medicines and the treatments that we have, how did we come there? And finally, from my position in the World Stroke Organization, where I will be the next president, I have now a broader view of what's going on in the world, not in Europe, in Central Europe, where we have wonderful resources right now, but what's happening in the 80 or 90% of the world that is not equipped like we are. And this is somewhat a very sad story, and we need to work and we need everyone to help on the implementation of what we already have for all the other people in the world. So that is what I'm going to talk about in the next 40 minutes or so, and let's start with the burden of stroke. First, the definition of stroke. Very simple. Stroke is a sudden loss of neurological function caused by a disturbance of the blood supply to the brain. And there are two major forms of strokes. One is the brain infarction. That is due to low blood supply. And when we do a CT scan, we see an infarcted area of the brain. Can be small, can be large, like in this case. Everything that is in this dark gray is infarcted tissue. That means from one of the hemispheres, only one half is still functional, and that is not easy to cope with. The other is the brain hemorrhage. This is just the opposite. This is too much, and it's blood in the brain, not in the vessel anymore. And on a CT scan, it looks like that. Fresh blood would look white. And you see, this is also a very large lesion on the other side of the brain. But otherwise, the patients, those two patients, are both very severely affected. They are bedridden, they cannot move one half of their body, and the poor guy with the bleed would not be able to speak a single word. So, and this happens instantly. This is like a stroke by God, and that is why in most languages this disease has something to do with stroke, with striking. In German, schlagen, Schlaganfall. What's it in Hungarian? Does it also mean something like a stroke?
Hirnblutung.
Yeah.
Hirnblutung.
Yeah, but yeah.
Hirnblutung.
Okay. Good. So another exception for for the Hungarian language. As I learned yesterday, there are many exceptions about that, but yeah. So let's switch gears now. NCD. This is the big new abbreviation in the World Health Organization. The World Health Organization is shifting its focus from infectious diseases, where it was for the last 20 years, to non-communicable diseases, non-infectious diseases. And for the first time in the history of the World Health Organization, they acknowledge a disease called stroke. Stroke always was under cardiovascular. Stroke was a disease of the heart, also it affected the brain. Now it has been changed, and I will give you the information why. It's the epidemiological experience, how frequent stroke really is. So the NCDs are cancer, heart disease, not only infarction, but also heart insufficiency, stroke, diabetes, chronic obstructive lung disease, and dementia. And those diseases altogether are responsible for 60% of the death worldwide. They are also responsible for days of life or for years of life quality lost, for years that you survive in a state that is not the state you were in before, and that is not the state you would love to be in. And stroke now has reached #1 in the world mortality statistics. It's the #1 killer in the world, more frequently killing people than cancer, all cancers together, or heart disease, all heart diseases together. This is something that many people don't know, that most politicians don't know, and we all have to agree, stroke was always in the background. When it was about money for the medical system, it was cancer and it was heart. And you see that not only in Germany, in Hungary, you see that in India, where you have cities with 10 heart institutes, but not a single stroke unit. So it always was in the background. It never received the funding, but now people realize that this is one of the biggest threats that are around. And this is true everywhere in the world. Because stroke is a disease of elderly people, life expectancy, because the fight against infections was so successful, life expectancy is going up everywhere. The highest growth of life expectancy is in middle-income countries, not in high-income countries anymore. We have already reached a very high life expectancy, so we can add 1, 2, 3 more years. But middle-income countries have added 20 years of average life expectancy in the last generation. Now, all of a sudden, these countries face patients, many patients with a stroke or myocardial infarction. Before that, they never reached the age to develop this disease. Now they reach it. And this is also true even in the poorest countries of the world, where also life expectancy goes up from under 40 to mid-50. And that also means they are getting the first wave of non-communicable diseases that will hit their system. More than 80% of all stroke worldwide occur in low and middle income countries. Not in our countries, where we have everything available to treat them. No, in countries where the medical infrastructure is already very poor. And now they are facing an explosion of diseases that they were not aware of before. This is a map with the stroke mortality rates around the world. And the same map, I could also tell you this is a map with the stroke incidence, the number of new strokes every year. Looks exactly the same. And you see the dark red ones and the orange ones. These are the highest populated areas of the world. China, India, Brazil, Russia. Russia, #1 in stroke mortality in the world, the highest, more than 50% nowadays. More than 50% of people who get a stroke in Russia will die in the first 3 months. This is worse than any cancer that you can think of. Isn't that true? And no one was aware of that. And then we have these bright areas where mortality rates are just 10% of what you see in other areas of the world. Stroke mortality rates for selected countries per year and per 100,000. You see 195 stroke deaths per year per 100,000 in Russia. Hungary, 68. Germany, 31. So this distance is not big anymore. And you see South Korea and Brazil, Mexico, they are all in the same ballpark. But look at Russia, China, Nigeria, India, all over 100. And this is a terrible situation. And this situation will even become more severe because of this. This is a projected increase until 2030, not so far in the future, of stroke in the countries listed according to their income. The lower line, the green one, that is high-income countries. No increase of stroke anymore. In fact, in the United States, Switzerland, probably also Germany, despite the rising age, the numbers go down. That's an effect of prevention, okay? They go down slightly. The middle-income countries, that's a red line, they already have a very high incidence, and this incidence goes up. Like the incidence goes up in the low-income countries, and the reason why the low-income countries have a lower incidence, I explained it already, that's the difference between 55 years of life expectancy and 70 years of life expectancy. So these are the 15 years where you will get a stroke in the end. And what that means, those countries that don't have the resources will get the patients. And those countries who are very well equipped with their resources, they don't get a real increase of those patients anymore. In the United States, stroke has dropped in the mortality statistics from number 3 to number 5. That's the effect of what we can do. But it's not the effect of what we can do everywhere in the world. Very short about the symptoms, and what people have to remember is stroke is a complicated disease, but it has a very simple pattern. 80% of all strokes present with 3 key symptoms. A palsy on the half side of the body or in one arm, in one leg, speech disturbances, visual disturbances. Sometimes, if the stroke is very severe, consciousness can be impaired. And the English language allows for a very nice and very impressive short version of those symptoms. It's the FAST test. And that says if the face is asymmetric, hangs down on one side, or if one of the arms is paralyzed, or if the speech is disturbed, F, AS. You have to think of time. You have to be very quick. And this is done everywhere in England and in the United States, Canada. They use this fast terminology to educate people, lay people, relatives, and patients about the most important signs and symptoms and the reaction that you have to take. So 20, 30 years ago, what was the outcome of stroke? Not in Russia, where it's 50% mortality, but in other parts of the world. There was a simple rule, the 25% rule. 25% would die in the first 3 months. 25% would be severely disabled, needing help, being dependent on help. 25% would be mildly disabled, able to walk, able to take care of the majority of things for themselves, but not returning to their previous life. And 25% still would go back to normal. They would still realize a little bit of deficits, but would not interfere with their everyday living. Come back to that when we have talked about what we can do nowadays. Risk factors and prevention. Well, the risk factors are twofold. One are